So, I don't know if you remember, but last time we had a very interesting challenge. How to improve your income in 20% in 6 months. Did you improve your income in 6 months? So there is one physician who really did it and is going to show you how. So I would like to invite Professor Lecturer Krenner Dobroshi. And I'm curious to hear because I'm going to learn how to do it as well. 20% in 6 months is a lot.
Thank you. Ladies and gentlemen, dear Alma. I don't know if you hear me. All right, now. So, ladies and gentlemen, dear Alma, it's a great pleasure to be presenting here today at Alma Academy in Barcelona. As Professor Atsi says, during his lectures, this slide popped up, and he said, if you have 3 tips that you're going to implement in your clinic, and if you see a growth of 20%, then you're going to be the one to present on the stage. And as I was reading these lines, my heart started to pump fast because I knew I was going to be the one to be presenting on this stage today. So it wasn't easy. I have implemented 3 risky steps, the first one being the opening of the second polyclinic, the second one being the opening of new channels, and the third in the marketing and sales at duty-free at the airport. So this is my second polyclinic where I have included new departments of dermatology, plastic surgery, gynecology, hair transplant, and beauty and spa services, and all of them. So I know all of you, you've been restoring your clinics or homes, and you can never plan the budget correctly, especially when it comes to restorations, because they increase. But in my case, I had to triple my budget, which was crazy because I really wanted to have a 5-star clinic or polyclinic. And during this time, I was working in somewhere between 12 to 16 hours every day. And as a matter of fact, I was losing weight, I was losing muscle, and my fat pass was shrinking. But thankfully now I'm back on course. I've added weight, I've added muscle, and I'm going to gym almost every day. And the funny thing is that one day a fake account, I think she was a lady, and she said, stop posting every day because you're bothering us with this gym and it's not a new discovery, okay? So I took her message, I posted one more time, and I stopped that. And my first risky step, it paid off with 6% increase in my services, that is in EBDs, and 5% in other services such as plastic surgery, gynecology, hair transplant, and so forth. Yeah, and that's me at the opening ceremony. And the expectations by 2024 would be somewhere in between 10 to 15% increase in EBDs, and the rest will be in the other services. The second risky step, however, was the opening of new channels, and this one has taken me around 1 year of intensive negotiations because I had to convince the giant social platform, which is called Meddan, that it's worth collaborating and opening the new channels. And finally, I convinced them, and we have just recently opened the new channels, and you are more than welcome to follow me or on all the platforms. And of course, this will not pay off very soon, but I hope in time it will. And I'm expecting to increase the aesthetic tourism and international presence, so that will be in time. And third risky step was the marketing and sales in duty-free at the airport. Initially, I am still doing marketing, and it's been around 1 year and a half that I'm doing the marketing at the airport on TV, TVs, billboards, baggage claim area. Yeah, you can see that's me. And yeah, on the TVs. And you see this picture of me holding the lasers. I have a friend of mine, and he makes fun of me. He's like, you're like Chuck Norris holding his guns. Anyways, you see at the gates, and then a baggage claim area, so all over. So I think most of you would think that this paid off, but the reality is that it did not pay off because the marketing did not increase my sales. However, during this time, while we were observing the passengers, we came up with another idea. I paired up with an influencer, makeup artist, And together we have a stand at duty-free shop where we exchange and sell our products. So that I made sure that my company and her company would be staying close to each other so that she has an incredible reach of 1.4 million followers in Instagram, and I wanted to make sure that my company and my name would be seen next to her. And the other thing is that on the sides of the stand, I've put my brochures and we disperse them to the passengers, and this has increased my cross sales of EBDs. So what would this 20% challenge distribution be? The first one being the 5% on other services such as plastic surgery, gynecology, hair transplant. And believe me, this is not easy, having many doctors at the same place and managing all of them at the same time. The second part being the 8% of my services, that is the EBDs, the products, the analysis, dermatology. And the third one being the sales, around 8% at the airport. So this is approximately plus minus shares of 21%. So what they have in common, all of these activities and implementations, is that they have in common the value. So my take-home message would be that focus on your value because the revenue and the profit will follow. So remember, value equals to profit and revenue. Thank you very much. It's been a pleasure.
So much. I will adopt it. Maybe I will see my face on the airport. Which airport, by the way?
Pristina Airport and soon 2 more airports.
All right.
Yeah, thanks.
Okay. So marketing as business is part of the deal, so that we have to do it. And for the next session, I would like to invite the next moderator of the session. This is Dr. Dean Berman. He's a good friend of mine. He's made in Israel and then delivered to the world. He's an aesthetic physician, lives in Vienna, and he's the medical director of Alma. So business is not me, is you.
Muchas gracias. Thank you very much. Hello, everyone. I hope you're very, very excited for the business panel that we have in front of us. We have some lovely doctors that I'd like to introduce. The first one is from Belgrade, Dr. Maria Boskovic. Maria, please join me. Thank you. From the UK, Dr. Munir Sumji. And last but not least, she was already on the stage from Australia all the way, Dr. Natasha Cook. Come join my salon. So the idea of the meeting today is slightly different. We want to speak to really doctors from around the world to share with us their business experience, and each and every one of them has a different concept to their clinics. I think that it's something that can really relate to everyone here, regardless of where you are geographically. And I'd like to start with Natasha. So if you can please start by just describing the concept of your clinic in Australia.
Okay, I'll try and keep this really succinct because what I do is not simple. So pretty much I'm a solo practitioner, dermatologist, and I employ aesthetic nurses. And I started off fundamentally with my dermatology clinic, which was labelled Darlinghurst Dermatology. Energy, laser bias devices, procedures, and what I address the 6 key skin concerns: acne, rosacea, pigmentation, sun damage, dehydration, and aging, skin aging. And then a personal kind of interest of mine starting over 12 years ago has been around the longevity and working with professionals in endocrinology and also with hormonal replacement, metformin, supplementation, time-restricted eating, which I now talk on all of this, and I will be having a super summary one-pager coming soon, but I'm still into the depths of 400 hours of reading to complete that. I then saw this gap naturally in my patients, so I was then talking to them about all of these things and how do I integrate it. So I started to sub-brand my clinic because, you know, if you brand too quickly, then referring people, referring doctors don't know what you're doing. So it's a slow transition to educate your referral base and your patient population. So I've now integrated a sub-branding of skin, laser, longevity, dermatology and health span. So then that way I can actually start offering the consultations around the health and the wellness space from a holistic point of view that I then integrate with the external, which is managing the skin and the aging and the energy-based device, complemented with injectables point of view. I've got a cosmeceutical skincare range that I've formulated since 2005. Yep, I actually did read Wolverton, which is the Pharmacology Dermatology Bible. And when I was an undergrad and at Harvard, I got really interested in skincare, pre-Instagram, pre-trendy, pre-Mary from marketing gone wrong, and literally devised product by product over a long period of time, a lot around pioneering research by an Australian colleague on the role of niacinamide in more than just an anti-aging, but also with skin cancer protection, etc. And then from that, I diverted out because I wanted to work out how I could have a clinic that I wasn't doing everything, just like our previous presenter. It gets exhausting, and I have had burnout, and I know how that feels, and it's not fun. And so I devised a clinic that I built separately onto the business that I had known the Face Bar, which became an entity designed and delivered by a dermatologist, but executed by nurse practitioners only, trained by me.
So what is the pathway? I'm your new patient. Nice to meet you.
Hello. Very nice to meet you.
No, thank you. Here's my credit card.
Excellent.
Can you please...
I don't do that bit. The others do. Yes.
Okay.
No, it's fine.
Give my credit card back. Can you explain to me, so what will be the pathway in regards to longevity? What is the wellness process that I'll undergo with?
Well, if we're really sensible, and I see the future as basically prevention aging, and lifestyle we know is 90% really responsible for how our skin and everything else ages. And hence this whole concept, we are going to live longer, looking better and being better. So, we can't just focus on the external anymore because the internal and everything else we're doing cross-communicates. And so I literally take a history. Obviously, the first thing I think is really important is your patients need to feel heard. So tell me in your words why you're here and what you would like to achieve from the consultation and what would you like from me. And years of being in clinical practice, I've sort of got this, I've refined how I do this, because at least then I can say they weren't heard, she didn't listen to me. And some people don't hear you, they just don't. Like some people, everyone's different. And as Afia mentioned a few minutes ago, there is so much psychology when it comes to dealing with human beings, let alone when they've got perceptions and problems with their skin. And we know we are going through an era of increasing personality disorders, narcissism is becoming normalised, and body dysmorphophobia. So it is complicated. So you need to be factoring all of this in, that the moment that person works in the door to be able to navigate that, so you know how to manage the patient, you know ultimately when to say no, and also from a psychological point of view, what they may be interested in, what may not be suitable for them, so that you can create a treatment plan. I always like to make the patient feel, I am not telling them what to do, we are working at this together, because accountability is really important, because if something goes wrong, you want to have a relationship built that you can always navigate something that maybe didn't go according to plan.
So you mentioned that you're doing combined treatments.
Oh, multimodality all the time.
Can you describe to us the different modalities?
So I have about 15 different energy-based devices from different brands, different companies as well. And then I will, often if it's a brand new patient who's really not really had any other treatments by the practitioners or is energy-based naive, I will start with even skin tone. And so even skin tone to me which is basically, if we've got even skin tone, the skin immediately looks better. So I look at my devices like the IPLs or the BBL type technologies, and I bespoke design a treatment. I bring technologies together, and then obviously I'll treat pigment, vascular, is usually my go-to. And then once people have got confidence and they see a result from something that's not going to give them, one, not too much cost, not too much downtime, the next step I then go like, right, if we really want to rejuvenate your skin to that next level where we're plumping up and laying down and stimulating neocollagenesis, we're looking at kind of our fractionated therapies, which obviously mine is the hybrid laser. Then I start putting that into the plan. Then obviously we do look at what they're using as skincare. And then I will look at a lifestyle and supplements and how they're eating and what they're eating. And I've got a super summary on that because I work with a professor of endocrinology who has done some amazing pioneering research in all of this, including the role of metformin.
So you combine metformin, for example, nutrition?
Where it's appropriate, and we have the discussion. Obviously, this is a big consult. I may not do everything all the time, and you've kind of got to read your patient how much they can deal with. But yes, I've got blood work now for the longevity blood work. I literally sign off. It's all pre-printed. I have the super summary about the diet approach. I have certain supplements. It's all ticked off, so at least they have something to take home. We do the same with the skincare. And then I write out immediate plan, and I give them options. So I would say option A could be this, B could be this, C could be this. And so then they can navigate, and they understand the repertoire. Then they'll go to me. Well, some people are like, they're the early adopters, and they're like, you know what, I'm just in, let's get it done, and they might book that afternoon or the next day or whatever. Other people will need a lot more time and consideration to reflect, whether it's budget-wise, downtime-wise, or they're just risk-averse and afraid and scary. And I think when you're a naive person in the general public and you're not used to dealing with these technologies, you've never had a treatment before, it can be scary. So for me, it's also about reinforcing them. There's no right or wrong. When you're ready, we're here to communicate, and you can book in.
For our colleagues here that are interested to enter into the world of longevity, what would be your biggest tip?
Okay, it's a lot of reading. It's a complex industry, and it's $1 billion industry. And even to the point that many supplements out there, like GNC, which is a massive American supplement company, a lot of what they say in the supplements when you test them is not there because it's not stringently FDA approved. There are a lot of low-hanging fruit on the social media pages that all think they're longevity experts, and they are not. And there are certain things that are gospel, and most of the answers are literally in the food sources that we eat. So a lot of reading. And I am presenting on this in the US in a week, actually, after I come back, and I will have a summary. I may speak to Elmer about bringing it to the Academy next year.
Perfect. Thank you very much. In case you have any questions for Natasha, please write them on the app, and we will ask later on Munir. Welcome.
Thank you.
So I'm starting by showing a few numbers behind me. I don't know if you can see the screen.
Yeah.
Just to give a little bit of numbers in regards to your social media journey, I would say. I think that everyone here are probably using some form of social media, some more, some less, but definitely those numbers are extremely impressive. Okay, so you have, can you tell us how many followers altogether, approximately?
Well, yeah, I think that's an old graphics. There's more now.
Of course.
It's, I don't think it's, I think if I start from the beginning, I think probably the first platform I really took an interest in was Instagram. And the algorithm, I think, was a lot more different now. And I think over the time period, it's really important when if you haven't started anything on social media, is just to concentrate on one thing. Because if you're consistent with that one platform, then you can build and grow. So now, for example, on YouTube, I have more followers than what you see combined there. But I was only able to do that because I was more consistent on one platform. So if you feel like you have to start everything, TikTok, this, that, I think it's not a good idea. I think show some consistency for 6 months first, and then move on to other platforms. And that way, then you can attract different audiences. My Instagram audience has grown older with me, so over 10 years. And they might not have, they were seeking prejuvenation before, now they want rejuvenation. So it's all about allowing people into every aspect of what you're doing. So, we were just talking about wellness, and if you've got wellness within your practice, it's important to show people that are following you what you do for your wellness as well. And that all ties in very, very nicely. So I think, now, what I do is very different, mainly because I look at content in general now. And content in a world where I have very little time. Sometimes we all think in this room that we have maybe 4 full-time jobs, and your clinical practice is just one of them. So we have very little time. And the thing is, well, how do you generate enough content for Instagram, Pinterest, TikTok, YouTube, and be consistent with it? That's something that when I went to the academy in Dubai, the Alma Academy in Dubai, we were talking about it and we're saying, well, how the hell can you do it? So I came up with an idea there was, well, okay, let's do a top-down pyramid process, which was get the highest quality content that I would use on a platform like YouTube, and then record that, use that for YouTube, and then use smaller bits of that for all of the rest of the other social media platforms. So at least the content is still controlled by me, because you have to delegate some of these things. And when you delegate it, sometimes the message is lost. But if you really put that effort in to do that, which most of the time is 1 or 2 days a month, then you can get that good bank of quality content that then will stand the test of time. And that is something that I think, happens as an evolution, because not everyone wants to be on social media.
I'm quite curious to ask our audience. So I'm pretty sure that everyone are using social media here. Can you show me who doesn't use social media? Okay, I have 1 here, 2, 3. Okay, we do have 3. For those, how many of you are taking an emphasis that social media is your most important part of advertisement from the audience? Okay. Munir, what would be your tips for those that want to increase the numbers of exposures in social media?
I think that it's really important to get quality exposure, because I see it a lot on social media now. And I had a shift of focus about 3 years on my social media from, and I have no shame in admitting this, that you get drawn into the sponge that is social media to gain more followers, to gain more likes, and all these sorts of things. But actually, if I put a joke on there, I may get thousands of likes, but is that actually going to get me the right patient? No. So I think that the aim now and what is the future is to provide information, be a solid information source for your patients, and to present essentially what you're doing. How are you gaining expertise? Are you going to the Alma Academy? What are you learning from there? People want to resonate with that. So you'd rather have a few engaged followers than just people that don't. I mean, sometimes, unfortunately, in my clinic, because of the way that social media is, I might get people flying in from different countries to see me for a 10-minute consultation about Botox. And I said, you're on a flight for 8 hours and you're coming to see me for 15 minutes. I could have recommended someone in your country. So that we're not, as a physician, that's not going to give me the personal satisfaction. So I think look in your local area. All of these social media platforms have geographical locations, so you can be very clever about it. Look in your local area, do events within your local area on social media, and then you will see your clinic becoming busy. Don't go for the world. I don't think that's going to be a solid business strategy. And also ask yourself the question that if your social media was closed tomorrow, your Instagram, your YouTube, whatever you have, if it closed and they closed your account, would your business go away overnight?
Okay, very interesting. I have a question. So if I'll go back to the previous slides, and we see here that you've got different social media, so Instagram, YouTube, TikTok, etc.
Yeah.
How do you navigate between them? Because obviously what you'll publish on Instagram is not necessarily correct to the audience that you will have on YouTube.
So you've got various different analytics that you can do on these platforms now. There's many different ones. One that we use is Sprout Social. And you can see the demographic of the person that is following you. And they're very different between Instagram, TikTok, etc. TikTok's a much younger demographic. We tend to just tell people on TikTok more about kind of skincare, what they should be using, looking after their skin, etc. And on Instagram, it's a slightly older age range. On Facebook, again, it's a little bit different. And YouTube want information. So, and that's the magic of creating content that encompasses these things, and then being able to extract that and then spew them off to each different platform.
We have a question that arrived, and I want to ask you for the newcomers. Those that, you know what? Let me rephrase my questions. If I would introduce you to yourself 5 years ago. What would you teach yourself then? What would you do differently after the experience that you've got from social media today?
I think that what I would have done differently is looked at my strengths and made a plan and just stuck with it for a while, because I had somebody approach me after their last academy and said, look, Dr. Somji, I don't want to really show my face on. And I showed them one of my colleagues who hates being on camera, but just posts about information and treatments in such depth that it's really engaging for the audience. So I think that don't try and be somebody who you're not, be yourself, and you will find a place for yourself on social media. And that's the beauty of social media, is that you'll find communities of people that will be like you. And hey, when they come to see you, it's an easy consultation as well. So, you know, you attract who you are, a reflection of what you are, and that is that's very present on social media. So I think have a plan, look at your strengths, stick to it, stick to one platform for at least 6 months so that you can be regular. No point posting once a month and then not posting again for like 2 months. Try and be regular. If you don't want to post every day, post 3 times a week, it's fine. But as long as you're regular with that, and then you can build from there.
Maybe a question for all three of you. From content perspective, do you come up with ideas? Do you get questions from audience at home? What is the process in your social media?
I'd say both. I think asking your audience what they're interested in is a really easy way to get stimulated to think about topics that are going to be successful on your platform. And I think what Dr. Munir said is really important. It's work out your brand and who you are and be consistent. And I think it's always quality over quantity when you're posting as well. Less is more.
Yeah, I mean, I think that we know what people, we have an idea of what people should know. But I think it's always important to ask those questions. And you can do that on these platforms where you can ask questions. And I would say that that is probably one of the most really kind of useful things for an engaged audience. So, you know, I have other doctors in my practice, and sometimes obviously not everyone can, I don't want everyone to see me. And it's useful for the doctors once weekly to do question time. And patients love it. So they put in their questions, you can screen the questions, and also, so it helps with the engagement, helps to know the staff members, but also you know what people want to know as well. So, and you get an idea of what's popular, so it's very useful.
Perfect. I'm reminding you guys, if you have any questions, please use the app in order to ask us questions that will go directly to our panel. Maria. So
Hi.
You are named the king of laser in Serbia.
Yes.
Okay, it's a very cool nickname. Can you tell us a little bit about the concept of your clinic?
In my clinic, I started the clinic 3 years ago, but I'm in aesthetic business for 15 years. First, I started with injectables, skin boosters, and everything toxins. And after a few years, I think something missing, and then I know a little bit about Alma Lasers. We got the distributor in our country, and I started to going on the events which Alma represent in Serbia, in countries around Serbia, like Bulgaria mostly. Then I meet Dr. Eva, and I start to learn a little bit about the lasers from Dr. Eva and Dr. Pablo, because in Serbia we don't have clinics specialization for lasers, no in dermatology nor in aesthetic medicine. And that's why I start to learn about the lasers from the Alma. And after 1 year of learning, only learning the lasers, it was my first thought to start the laser clinic, first that kind in my country. And I started with Alma Soprano Titanium. And for the first year, I was only the doctor for the laser epilation. And that's how I built a lot of clinic income patients in my clinic, and I started the cross-selling. My first revenue of the laser epilation was after 6 months I pay off my first laser, and I started to build the clinic in the 3 years. Now in April I have 10 platforms of Alma and the other companies. I have 20 of my staff working together with me, and Alma distributor in Serbia and Alma general in Israel help me every day to build more. So I will have the future, I hope, like these two doctors, like my mentors.
Good to hear. I think that the questions that probably crossed everyone's mind at some point is regarding the priority of what to buy, because Alma's portfolio is so wide and you don't know from what to begin. So you began with titanium.
When I started to thinking about the laser, my first love was Alma Harmony, and I wanted to have big platforms for lasers, IPLs, and everything. But Dr. Pablo was in Serbia visiting us for one weekend, and he's suggested to me to start with laser epilation because you will have a lot of patients coming in the clinic. You will have big revenue every day. It's easy to perform. You can delegate your nurses, and I was say, okay, I will listen to Dr. Pablo because he has more experience. And really, in 1 year, only 6 months, I pay back my laser. I have so many patients in the clinic. I have my nurses, when they do the laser epilation, they offer consultation, free consultation with me for the face. After that, when I bought Accent Prime, I have a consultation for the body, and I expand to all face and the body maybe in 1 year and a half probably. And after that, the second machine, I was always say, okay, I will take Alma Harmony, but my nurses was like, oh, we need Accent Prime, and then we okay, we both machines comes in the clinic in the same time, Alma Harmony and Accent Prime, and it was more business for me and other doctors to work with lasers and for my nurses. So my nurse staff goes up in fast manner.
So
and
if I will ask you to give your recommendations for the order of going with the devices, from what to begin, what will be your top 5?
First, for everybody, I think laser epilation, because it's a solid money income. Every day you have good sleep. You have money to pay your employees and to buy another machines, because it's easiest way to buy other machines. I never had bank credit. I do it only from my business with Alma lasers. And for me, when I start to learn about Alma lasers, I have our local distributor for Alma. They have good learning for me, and now I'm learning other doctors how to perform laser epilation in our country. And we have had, I think, 40 titanium in the Belgrade, and every doctor works with laser epilation, and they now buying just like me. They going my pet. They have now Alma Harmony, and now they start to buy Alma Hybrid, and they copying me, but it's okay. It's enough job for all of us.
Okay. And what's the future? So you have all the devices. What is the next step?
I never think that I will be expert in rosacea, in melasma and scars and everything, but now with all the lasers, I have all indication in my clinic, and now I want to, I now bought a new place for new clinic, also new Belgrade, and in the future I want to open the clinic for Alma Duo and FemiLift, and to expand to gynecologists and neurologists to work with me in that part of the health and anti-aging. I'm probably too far from wellness, and in my country, it's maybe, and it's not now the time, I'm maybe in future years, but I think Alma Duo and new clinic in that part will be my future. See you on next academy, how it works.
Perfect. I think that if I'll summarize what all of you have said, the most important thing that I've noticed is medical education. So
Yes.
at the end of the day, we're talking about how can we educate our patients in order to, of course, enrich their knowledge, but also to join them and to follow them in their journey into this wellness, social media, etc. What do you think about that?
Most important for me, it was to learn something in lasers and in aesthetic, and Alma was a very good partnership for me. And it lasts for 5 years. We are in good relations to learn me everything I know. If I something don't know, they call by the phone, I have the answer, and I just pass that to my patient. On social media, I want to be very serious doctor, not funny doctor. And from the start, I want to attract the patients which wants to serious doctor. And I have just aligned a new machine, my knowledge from Alma. I only deliver that on social media. I represent my new machine, my knowledge from today, from academy. They see that I'm very serious, that I'm teaching something, and it's go fast. And they all want to be to put their face to the doctor with the knowledge, not funny doctor.
So firstly, I'd like to take this opportunity to thank the clinical team. Kudos from here, from the stage, for helping and to educate all of us in regards to Alma devices. Which brings me to another question to Munir regarding social media. So part of the learning education can be quite boring.
Yeah.
How do you overcome this topic? So it's a question that we received from the audience, but how do you overcome this perhaps boredom that might goes with the education part?
I think that it's an interesting question. I think that there are ways of generating content that you can make it engaging for the audience. Use of videography and cinematography. Also looking at patient journeys as well. So when patient comes into the clinic, how are they assessed? So you can see that if you're doing, I don't know, a Visier analysis or anything beforehand, they can show the level of detail that you're doing, and then having very clear, succinct points of, say, for why Alma Hybrid something different, for instance, you could do that. And then the other side of this is maybe you don't want those patients that are getting bored by that information. Maybe you want a patient that's going to understand the pre-care, stick to the aftercare, understand the limitations of the procedure, because the last thing you want is, and when I used to post a lot of before and afters on Instagram, like, Dr. Somji, why is my before and after not like this? Well, every person's different. So I think it's really important, like has been said previously, look, actually, you want to be presenting the right information in a professional manner, talking about all the different techniques that you've learned from Alma, etc., as a synergistic relationship, and you will attract the same type of people to your practice. So you don't want everyone, is the conclusion there.
Very good. No, I think it's very, very good tips. So I thank all of you. We will not take the coffee break now. We will continue directly to the next session. So thank you very much to all of you. I think it was very knowledgeable. I'm looking forward to see the new numbers of followers in the next session. Okay. So thank you, everyone. And